So I want to go back and reference my last video that I posted about the Addy. First of all, I also forgot to mention that it is a lot more affordable now. I believe you can get a 1 month supply for about $39, which is great. Before it used to be like $129. If you have commercial insurance, you can actually get it as low as $20. So it just depends on, the case. The other thing is, why is let's just say female health or female desire health, let's just put it that way, why is that important, and why is that pertinent to a weight management area or clinic, for example, in our case? It's extremely important, and they go hand in hand. Reason being is because excess fatty tissue, when it's built into the abdominal area, not just in women but also in men, it acts like a hormone. And by acting as a hormone, it has an enzyme called aromatase. And for those who know a little bit about like the bodybuilding world and things like that, aromatase for men is known to convert testosterone into estrogen. And so that's why men who suffer with obesity tend to develop gynecomastia, which is excess breast tissue. And so once they lose weight, they tend to lose it for the most part. Some don't, and some don't require surgery, especially if they got really high up there in the weight scale. But it does the same thing in women. In women, aromatase converts estrogen into testosterone, which is why there are women who suffer with hirsutism, which is abnormal hair growth, like facial hair. And then women who suffer with PCOS as well. It's because of this excess androgenic hormones, or hence testosterone. So when women lose weight, then these things tend to improve. And so how that is related to the whole desire topic that we were talking about, because when you have excess testosterone, low estrogen, that is a hormonal imbalance, and one of the most common causes of issues with hyposexual desire disorder is not defined as a hormonal imbalance, but that is the first thing that is looked at before it's diagnosed, if that makes sense. So as I said previously, HSDD is defined as the lack of desire without any hormonal deficiencies present. But for that, it needs to be worked up. So if there is a hormonal deficiency, hence women who struggle with PCOS, or who are on the larger side that have a hormonal imbalance, because this fatty tissue is acting as a hormone converting your estrogen to testosterone, then that can also be the case. So this is why these two things go hand in hand, and why we also talk about it and tend to treat it.